Lupe. I'm a physical therapist assistant at the Fulton County Medical Center.
And I'm Christopher Hartman. I'm a physical therapist here at the Fulton County Medical Center.
And we're here today to talk about blood flow restriction therapy. It's a short interval and intermittent occlusion, which involves venous outflow and arterial outflow, and that involves a tourniquet. This is the tourniquet or the cuff. You can use it on your upper extremity or your lower extremity, and we have parameters that we follow.
Okay, so this is very similar to a blood pressure cuff. It can select its own pressure by actually occluding the arterial blood flow, so it takes it so you can no longer feel the pulse in your arm, and then it will decrease the pressure there, so that way we still get blood flow going into the extremity, but it limits that venous return coming back out.
And with that, the oxygen will be decreased in the muscles, and it will trick the brain into thinking that it's doing high intensity workouts when actually they're doing low intensity, low weight workouts. So some benefits of blood flow restriction therapy is it will increase bone density due to growth stimulation hormone. It creates like a neuromuscular stimulation, which will prevent muscle atrophy, pain reduction, and it will create a stimulus that gives you a quicker recovery. And also, there's substantial evidence in promoting the muscle size and strength when you're working out at shorter durations as compared to a regular exercise program. There can be also a reduction in limb loss, and it will increase your cardiovascular fitness. Who benefits from blood flow restriction therapy? Immobile patients that are on bed rest, pre and post operative patients, casted or braced injuries, athletes, or muscle disorders. We have a list of contraindications if you're unsure of whether this treatment might be good for you or not, and they'll be listed. And this treatment is billed through exercise, so insurances do cover it. Now we're going to demonstrate how the cuff actually works.
So there's set protocols that you do with the cuff on. So as the cuff is inflated and you go through the exercise, the body does feel it fatigues out quicker, so it's like you're getting a high intensity workout without having to do extreme amounts of weight. And it goes through multiple sets or repetitions as well. Just to show, my right arm, you can see where it's starting to turn a little bit red. It's changing color compared to the left.
Especially in the hand.
Especially in the hand. And that is due to restricting that venous return. So if I turn the cuff off and deflate it, as it's deflating here, the color, skin tone will go back to normal, and then that would conclude that exercise.
So this is very safe, and it's very individualized for each patient, and we have parameters for each one, so it is not in any way unhealthy for a patient to use this during their exercise program. So in conclusion, if you feel that blood flow restriction therapy is something that would be for you, contact your family doctor or your specialist, and they can give you a script for physical therapy or occupational therapy to provide this service to you.